it again? Zuri.
How do you say turn that damn thing on? Say something beautiful for EWB.
I'm a traveler.
He's a traveler.
I'm going to Ngelenge.
Nice.
The Tanzania project came to EWB USA through one of the San Francisco chapter's volunteers, a woman named Maggie Montgomery. She was studying in Tanzania in Dar es Salaam on a Fulbright scholarship, and she met our partner there, a man named Atanas Haule, who is from the village of Ngelenge, and he was studying for a master's degree in environmental engineering, also at University of Dar es Salaam. Ngelenge is a very, very far place from San Francisco. It's not an easy place to get to. It takes about a 36-hour plane ride, and that takes about 2 days. Then once you're from San Francisco to Dar es Salaam, once you're in Dar es Salaam, it takes a 14-hour bus ride to the village of the town of Songea. That's another day of the travel, and then the next day you take a 5-hour car ride on a dirt track to get to the village. So it's a long way away. It's not an easy place to get to. And the way I like to visualize it is, if you take a globe and you put a finger on San Francisco and a finger on Ngelenge, you can hold it up with almost no pressure at all. The village of Ngelenge formed a community-based organization called Ngelenge, which stands for the Ngelenge Development Association. People from the village wrote to family members and friends that had lived in the village and had moved to Dar es Salaam and said, we have these issues in the village, we would like you guys to help us. The way the project has progressed, we started with a first site assessment where Maggie went out to the village. She spoke with the village leaders, she spoke with the surrounding village leaders, she spoke with villagers, and got a general sense of what the main priorities in the village. And what she came back with was what the #1 priority in the village was: a health dispensary. The village had identified 2 other major needs. One was water, and the other is agriculture.
Na kuangalia kazi ngumu mliofanya katika kuboresha urafiki wetu.
We're very excited to be able to help you complete the next step.
Tuna furaha kubwa kuwasaidia nyinyi katika hatua ya pili ya kujenga zahanati yenu
And have a dispensary of your own.
na kwamba muweze kuwa na dispensary yenu au zahanati yenu wenyewe.
As I said, Ngelenge villagers were getting health services from 2 dispensaries. One is from Lituhi across the Royal River. This dispensary is run by the missionaries, and when you get services, you have to pay for it. And there's one health center where we get also services. It's government run. We pay just a little. It's far away from here. It's Manda, about 7 kilometers away. Usually people of this area, because they are very close to the river and close to the lake, mostly suffer water-related diseases. So we have malaria, which is very rampant, diarrhea, and bilharzia. But also child mortality is very high in recent years because there wasn't water for the people to take care of. Yeah. In September last year, 2005, the first team from EWB came. That was consisting of about 5 people. So we came back here with the team. We went through Songea. We purchased material for the dispensary, the roofing materials, the concrete like cement, the iron bars, and other accessories. So these materials were left here for Ngelenge to do the real civil work.
So what is the estimated time for the dispensary to open?
Oh, almost 1 year.
Almost 1 year?
We have 6 months to construct the remaining buildings. That is the toilet and the doctor's house, and also The government itself is committed to construct one more house for the doctor. So they've given us almost 1 year.
Very close to Ngelenge. So from here to Ngelenge is about 12 kilometers.
What are we doing right now?
Right now we have a problem with the car. Another problem with the car, but the road is not passable for this car, type of car. Which is a very low diff, and the bridges very sharp edges.
Kidogo, kidogo.
The Health Project, our goal was to do a somewhat comprehensive survey of women's water usage practices and also the health of their children and entire families. So we worked with a PhD epidemiologist and designed a 62-question survey based on some questions that we had gotten from the CDC. And we made them more specific to Ngelenge. And the idea was we would interview women with children under the age of 5. Some sample questions would be things like, did your child under 5 have diarrhea last week? What are the illnesses your family had in the past year? Where do you get your water? And break that down by where do you get your water for drinking, for washing, for bathing. Do people touch the water that's stored in your house with their hands? For what activities do you use soap? And what is the condition of your latrine? The women that we spoke to seemed very willing to answer our questions. Some were even eager that we were coming and would be seeing their house and sitting on their mats with them for a little while for some personal time. We are very successful in collecting data. We now have 147 completed surveys, and we're in the process of entering that data into a database created by another volunteer who is an epidemiologist. At that point, once the data is in and cleaned and QA'd, we'll do some analysis on the frequencies of responses to each of the questions, and then maybe try to do some analysis comparing responses to one question to the responses to another question. At that point, we'll write a report summarizing our results and think about effective ways to share that report with both our chapter and Ngelenge as well as the village itself, since of course it was a significant contribution by them to sit and answer all of our questions. We're excited to convey the results to them.
Tell her the second thing we'll need will be the dipper that they dip for the water.
Kitu kingine kinachohitajika ni kikombe ambacho tunatumia kwa ajili ya kuchotea maji.
Okay. So I'll take 3 samples of this. 2 will be for the membrane filtration, bacterial test, and 1 will be a confirmatory test with a patho screening where we screen for hydrogen sulfide bacteria. The second sample we take is of the lid of the storage bucket, and this is just testing for any contamination that could actually fall into the water while it's being stored. So we take a swab and just basically wipe the inside surface of the lid really good around the rim of the bucket, just anywhere where that lid's been. The third sample we take is of the hand, and we're testing for just like general bacteria that might be on the hand that could potentially contaminate any of the water or the food and stuff.